Good afternoon and welcome to a special live town hall, Your Health and Keeping Our Economy Open, COVID-19 Community Update. My name is Erica, your moderator on the call. Your Douglas County Commissioners Roger Partridge, Laura Thomas, and Abe Layden are live on video and looking forward to hearing your thoughts as we take on this community conversation. Also joining by phone and looking forward to answering your questions are Dr. John Douglas and Jennifer Ludwig from the Tri-County Health Department, and Kirk McCarty and Dr. Eric Lung from Skyridge Medical Center. Please press star 3 on your phone keypad at any time if you have a question that you would like to ask. You can also submit your questions on the website at douglas.co.us/townhall. We know everyone has lots of questions, and we will get to those very soon. So let's get started with some updates from your commissioners. Commissioner Partridge, please start us off.
Welcome, everyone. We are so glad to have you with us again this evening. We're into our 20s of our continuing series of telephone town halls. So if this is your first time, we welcome you. If you're a continued caller, we thank you for joining us again, which will most likely be our last telephone town hall of the year. So I'd like to remind everyone tonight what our topics are about. We have representatives from Skyridge Medical Center, and they're going to be sharing and providing information and taking questions on the update on our local hospital status. So when they're on the line, please feel free to listen and provide questions to them. Also, with Tri-County Health, we again have Dr. Douglas, who will be sharing present COVID data, and also Jennifer Ludwig, who will be able to answer your questions about the county's variance request to the state, which you'll hear more about this evening, and about restaurants being able to reopen for indoor dining. If you have heard, probably many of you this call have, that the county had allocated $15 million of CARES funding for restaurants and the event venues, called the Restaurant and Event Venue Impact Grant, for the opportunity of reimbursement of the impacts of COVID. Now, many of you have already applied for that program, and there has been funds already, well over $2 million that has been distributed. And we now want you to know that all of December's impacts of revenue losses are available. So you're able to go up to December 30th, not December 31st, but actually December 30th, because that's actually when the CARES funding completion date was set by the federal government. So 100% of your calculated, that's an important thing, your calculated December revenue losses will be reimbursed for up to a maximum of $200,000. So please visit our website if you require more information. And that website is dcbusinessgrants@douglas.co.us. Again, that's dcbusinessgrants@douglas.co.us. So thank you, everyone, again. We look forward to a very informative town hall and look forward to your questions. Thank you, Erica.
Thank you, Commissioner. And next we're going to hear from Commissioner Thomas. Go ahead, Commissioner.
Thank you, Erica. Good evening, everybody. In these unprecedented times, the three of us commissioners believe it's important that it's clear to all of you that we are working very carefully and closely with our state and public health partners. The commissioners do not have any authority whatsoever to override the governor's orders to close indoor dining. We receive emails every day from frustrated citizens and hurting families saying, please, commissioners, please open our businesses. And if we had the authority to do that, we would have a different solution here in Douglas County. But we have to follow the governor's public health orders. And so we are doing that today. Another thing that we are doing today is that if you've heard in the media, the governor has opened up a 5-star variance program. Applications can be accepted tomorrow. Our incredible staff have been working on this very closely, and we've got some good news for you. Commissioner Layden?
Thank you so much, Commissioner Thomas and Commissioner Partridge. Welcome to everybody joining us this evening. We certainly appreciate this opportunity to engage with you. And I think Commissioner Thomas says it well, and we certainly share this perspective that in this pandemic, we are not only looking to protect lives, but also livelihoods. And so when we hear from the business community, certainly restaurants in particular, we recognize that there are people trying to put food on the table and businesses that need to stay open, and that right now, as tenuous as it is, any opportunity to move forward is going to be met with some positivity. And specifically, right now, Douglas County is launching our certification program for businesses. Now, just to be clear, this is not administered through the state. By noon tomorrow, if you go to the Douglas County website, you'll be able to go to a Certify My Business section. And if you just type that into the search bar, you will be able to certify your business for the opportunity to move forward with this 5-star certification program. So specifically, Douglas County, in collaboration with our municipalities, the business community, Tri-County Health Department, is creating this infrastructure in accordance with the state guidelines for the 5-star certification program to certify eligible businesses in Douglas County. So our program would be called the COVID Best Practices Program, and it's designed to recognize the tenuous circumstances that businesses are experiencing as a result of COVID-19 restrictions. So please look for that tomorrow at noon. Again, I think you're aware that this Board of Douglas County Commissioners has been very actively engaged with the state and with our governor. We issued correspondence on the 25th of November asking that our businesses be allowed and afforded the same opportunities that Mesa County has been offered in their 5-star program. So we're excited to share more about that this evening.
Wonderful. Thank you, Commissioner Layden. And thank you all, commissioners. We look forward to taking everyone's questions. I see a lot of people are joining this call. If you have just joined, again, that's *3 on your phone if you'd like to ask a question. And we do look forward to taking those questions in just a few minutes. And we'll start with questions from the restaurant community right after brief updates from Sky Ridge Medical Center and Tri-County Health. Again, to ask a question, that's *3 on your phone. If you would like to ask one through the website, you can do so at douglas.co.us/townhall. And now let's hear from Kirk McCarty, CEO and President of Sky Ridge Medical Center.
Hi, everyone. This is Kirk McCarty, and I'm really excited to talk to you tonight. I can say, honestly, for the first time since the COVID pandemic started, I have a lot of hope for the future, and I'm going to share that in just a few minutes. But before I share that, I would really like to just say thank you to all of you. It's been a few weeks back that we came on a scenario very similar to this, and shared with you that we needed you to wear masks, we needed you to wash your hands, and we needed you to socially distance. And I will tell you that going into the Thanksgiving holiday, I was very concerned that folks would not follow that advice, but you all have. And I'm excited to say that our COVID population in our hospital has, over the last really 5 days, has seen a dramatic decline, really going in the positive direction. A most recent update that's just really kind of hot off the presses is that, so at Sky Ridge Medical Center, we have a total of 36 COVID positive patients. And for those of you that don't know, just to give you context, at our peak, we were near 60. And as I look at what's been accomplished, it's truly a great thing that you guys have listened and heeded the warnings about wearing a mask. The other thing that I would just like to share with you is, Douglas County is very lucky to have 3 hospitals in its vicinity, and all of those hospitals work together to manage the patients in Douglas County, but also the hospitals within the whole metro work together. And so we've continued to work together as this pandemic has gone on, and I really feel lucky to be in this healthcare environment that allows us to do that. And then finally, the part that I'm most excited about and that I have just the most hope and optimism about is yesterday we gave our very first vaccine for COVID. And it was an ICU nurse that started, that was one of the original employees at Skyridge. So she helped open Skyridge up. We received about 900 doses of initial doses for COVID vaccine, and we've actively been vaccinating our employees, our doctors, and it really gives us a sense of hope seeing the decline in the COVID volume of patients, but at the same time, being able to know that we have something that is going to eliminate COVID in our healthcare workers. It obviously is very scary to take care of people that have COVID, but it is our job, and having this vaccine really makes a difference. We anticipate getting enough vaccine over the next week that we will be able to vaccinate 100% of our employees, our doctors, and any of their staff so that we can move down the path of having more people not at risk for COVID. And so I will tell you from a healthcare perspective, masks are still important, social distancing is still important, washing your hands is still important, and as long as we keep doing those things, our hospitalizations will decline. So as I wrap up my statements, I just wanted to reiterate thank you for everyone heeding the warnings that were put out prior to Thanksgiving. I know it was a challenge, but we do appreciate that, and it's allowed us to maintain the great care that's provided at Skyridge Medical Center.
All right, wonderful. Thank you, Mr. McCarty. And now let's hear a public health update from Dr. Douglas. Dr. Douglas, go ahead.
Yeah, thanks, Erica. Very nice to be with everybody this evening. Particularly nice to follow Kirk with those words of excitement. I haven't seen anybody get a vaccine yet, although we're seeing it in the news. So great to know that our colleagues at Skyridge are well on the way. I want to alert everybody who's not watching breaking news. The FDA Advisory Committee did make a recommendation that the second vaccine, the Moderna vaccine, looked good enough that it ought to also receive an emergency use authorization this afternoon. Hopefully the FDA will act on that. That'll give us another vaccine, and it will give us a whole lot more supply, so that good news just continues to come. I want to join Kirk in thanking folks across our counties in Douglas County tonight for really, as he said, stepping up and doing the right thing. I think, like him, I was worried before Thanksgiving about what was going to happen. Every piece of news we had suggested we were going to see a surge. It was certainly predicted, and frankly, it was seen across much of the country. We didn't see it in Colorado. We didn't see it in our three counties. We had a little tiny blip post-Thanksgiving. But I think that the efforts that were taken throughout November and into December, and frankly, they seem to be ongoing. I just looked at our latest stats. The downward trend has continued, are extremely encouraging. We've seen Douglas County, for example, with its case incidence rate. This is a number of cases per 100,000 population over a 14-day period, dropped by 15% a week ago. It's down to 706 this evening. I mean, that number means a lot to me. It may not mean to you, except that one of the thresholds for the county opening back up even more, apart from the 5-star program that we'll be talking about, is getting the county from the red level into the orange level. That starts at 350. And if we can continue the rate of improvement from our current 706 down to the 350, should take us just over 4 weeks. So I'm incredibly encouraged by the news we've seen. We do still, as Kirk said, have plenty of people in the hospital. Less, that's great. We do want to take this next round of holidays carefully and safely because we don't want to. We want to pat ourselves on the back for Thanksgiving, but not forget that we've got to be attentive during the rest of Hanukkah, Christmas, New Year's to be sure that we take those precautions. One of the observations that's been made, honestly, because while vaccines are going to be rolling out increasingly, but we won't really get to the general part of the population probably till April, May, is that between now and April, May, that continued use of mask wearing, which has become, I think, pretty normative. I think a lot of people who weren't wild about doing it have just sort of hunkered in and said, I can get through this. Between now and April and May, it's predicted that mask wearing will actually prevent more deaths across the state than actually the vaccine, because we won't have it in enough arms by that point. So I think if we can hang on with these approaches that have been so successful, we'll keep Skyridge able to serve all kinds of problems, not just COVID, and we'll keep our community safe and getting back on the road to full recovery. Thanks, Erica.
Great. Thank you so much, Dr. Douglas. And now Jennifer Ludwig, also from Tri-County Health, will be sharing more about the variance request to the state. Jennifer Ludwig, go ahead.
Great. Thank you, Erica. And thank you, commissioners and Commissioner Layden, for giving the information and laying the foundation for the application that is going in tomorrow. And I have the honor, I guess, of representing the group that really worked very hard over the last couple of weeks to pull together a program for Douglas County and this application. So I want to recognize and thank all of the partners who really stepped up these last couple of weeks and devoted a ton of resources to developing this local program. And that includes Douglas County for taking the lead, all the municipalities in Douglas County, the chambers, the library district, and there are others that I'm probably forgetting. What this program is, and the Douglas County Certified COVID Best Practice Program does, is it provides an increase in capacity for businesses who meet really strict criteria that is outlined by the State Health Department. The State Health Department released their framework. It's the 5-star statewide framework yesterday, and it has a series of checklists depending on what industry your business is in. And all of those criteria must be met for a business to become certified under this program. And once certified, the business can open with additional capacity based on the dial. So as you may recall, we've talked about the dial on previous town halls, and there are different levels. Currently, Douglas County is in level red, which for restaurants, that meant no indoor dining. With this certified program, restaurants who certify would be able to open up at the level orange of the dial, which is 25% capacity or 50 people. And so it provides additional capacity and lesser restrictions for operating. And it's great news that we've been able to put together an application. As soon as that opens up, we'll be applying tomorrow. And as Commissioner Layden talked about, the Certify My Business webpage will become available at noon. Businesses can start the application process, but I do want to stress that no business can open at a less restrictive measure until they are certified. And we have to wait until we receive approval to start the program. We must be approved by CDPHE, the State Health Department, before we can even start implementing the program. But it's great news that we'll be able to at least start the application process so that we'll be able to hit the ground running once we receive approval from the State Health Department. So we're looking forward to working with all of our businesses to help them open in a safe manner that protects the public's health and helps with our economy. So thank you very much. I look forward to answering any questions about this program.
Wonderful. Thank you so much, Jennifer Ludwig. And now that we have had all of our updates, let's get to our questions. And again, just a reminder, to ask a question this evening, you can press *3 on your phone or send your question through the website at douglas.co.us/townhall. Okay, we are going to start with an online question this evening from Becky, and she asks, what data was used to decide that restaurants could not provide indoor dining in level red?
So I assume that's for me, Erica? Dr.
Yes,
Douglas?
That's for you, Dr. Douglas. Thank you.
Yeah, okay, thanks. That's such a bullseye question, Becky. Thanks for teeing us off with that. Let me say that again, the red level the orange level restrictions are embedded in the state public health order that Tri-County, like any public health department, is involved in enforcing, but it is an order that was issued by the state. The big picture on this is the state ended up including certain parameters in their dial based on both biologic plausibility as well as data that's been accumulating since the beginning of the pandemic. And what that means biologic plausibility-wise is we know that indoor spaces are at greater risk because of more limited ventilation than what one gets outside. That's in a big part what's going on with our fall surge. We also know that a setting where masks, we've talked about masks now several times, cannot be worn consistently creates greater opportunities for spread. So that's kind of the plausibility argument. The observational data have been coming from lots of different places. From last spring, a large study published about a month ago from 10 metropolitan areas around the country, which tracked on cell phone location data. That's an indirect way of saying where was someone during a time they could have been infected. Restaurants and cafes, and the next gyms, and then next houses of worship were in each city, 10 big metro cities across the country, were the top places seen. Well, you might say that's just sort of cell phones. What does that have to do with actually acquiring infection? A really important study was published by the Centers for Disease Control in September, and it performed what's called a case control study, which you look at people who got sick and you look at people who didn't get sick, and you compare their exposures. And what that study ended up proving or showing pretty clearly was quite similar to the study that I just mentioned. It's restaurants and gyms and houses of worship, places where either people are less likely to wear masks or where they may be doing heavy breathing, as in a gym, that appeared to be associated with transmission. That's really what led the state to include those parameters in their framework. I would have to say that we look at the exposure data that we collect when we do case interviews, and while we know that data is incomplete, we only get sort of complete interview information from about 75% of people. We saw a pretty similar trend that when people told us, where were you during your likely time of exposure, the top two things that popped up were personal gatherings. We were concerned that people were gathering in the homes of others without being careful, and restaurants. Now, that's not proof based on that data, but it's part of what we consider to be triangulation of public health data with the various observations aligning together.
Wonderful. Thank you, Dr. Douglas. We have another online question. This one's for Jennifer Ludwig. Jim wants to know, who monitors the certification process?
Great. Well, thank you so much for that question. The state certification program framework that was released for any county who wants to implement this program must establish an administrative committee. And so for Douglas County, we have an administrative committee established, and that is a point of contact for the Douglas County government, Tri-County Health Department, all of the municipalities, our library, and our chambers. I believe that's everyone on the administrative committee. So this is really kind of the governance board, the oversight group. And so that group will monitor the program, ensure its effectiveness, troubleshoot any issues that we have with it. We'll do the marketing, reviews the applications, does the on-site inspection, approves the certification, and then also assists Tri-County Health Department with the compliance and enforcement side of this program. We, as Dr. Douglas mentioned, public health departments are required to enforce public health orders, whether there are ours or the state health departments or the governor's. And so, but this administrative committee really is the one with the oversight for the COVID best practice certified business program.
Wonderful. Thank you so much. We are actually going to go to a live call, but first I just want to remind everyone again, and anyone joining the call, if you would like to ask a question, just press *3 on your telephone. That'll get you into the queue. and we'll take your question, and then we'll try to take you live. Okay, our first live question of this evening is David, and David is live now. You can go ahead and ask your question.
Hi.
David, your question will be for Jennifer Ludwig. Thank you. Hi, David.
Hi. Thanks for taking my call. I was listening you talk about the certifications and everything that the restaurants have to go through. I was just wondering, going out and about, I was just wondering if the big box stores, the grocery stores, the Targets and so forth have to go through the same certifications or level of scrutiny that they're putting the churches and the restaurants through.
Thank you for that question, David. The certification program is strictly voluntary, and so any business can choose to apply and become certified. The benefit of becoming certified is that you can operate at a higher capacity in the dial. So as we mentioned, there's 6 levels in the dial. We're in level red. So for a restaurant who certifies in level red, they would be able to operate at that level orange, which gives them the ability to have indoor dining at 25%. So our big box stores or retail stores are already opened at 50%, and they could apply for this certification. They would have to meet stricter requirements that ensure that they are employing stricter safety measures, but they're already at 50%, and most retail, by certifying, they may not gain much more. Our businesses that will gain the most by going through this certification program are indoor events, restaurants, gyms. Those businesses were most restricted in level red, and therefore we will be prioritizing those businesses that have had the most restriction up to this point. And then we will start to work on other businesses who want to become certified. But the program is open to any business, any industry, and it is completely voluntary. But we will start out with prioritizing those businesses that have been most impacted by level red.
Wonderful. Thank you so much. And this next question is for you, Jennifer, as well. It comes from Michael. He's online. He would like to know, what is the definition of enough airflow to qualify for a restaurant as a patio? For example, if you have 2 garage doors on different walls, that's considered airflow. Go ahead, Jennifer.
Thank you. So airflow, when we look at outdoor dining, it must be 2 non-adjacent walls have to be open. So if you have 2 garage doors, they can't. We have to have airflow moving through them. Or if it's a tent, the tent can't have a ceiling and 4 walls around it. That would be mimicking an indoor location. So it has to be 2 non-adjacent walls that are completely open, not just windows. They'd have to be, floor to ceiling wide open to be able to have that airflow. So I'm hoping that answers your question. Thank you.
All right, great. And just to let everyone know, I do see a lot of questions coming in about vaccines, and I just want to let everyone know that we will get to those questions in just a moment. Okay, next we have a live caller, and we have Kevin here, and his is for Dr. Oh, he just hung up. All right, let's go to our next caller. We have Louisa from Castle Rock, and she's going live for Dr. Douglas. Dr. Douglas, you can go ahead and answer her question. Louisa, are you there?
Yes, I'm here.
All right, go ahead and ask your question live.
Okay, my question pertains to the vaccinations, and I noticed that a lot of responders, first responders, and people like that are going to get the first shot. And then I think they moved on to the people in nursing homes. But I'm wondering how the people who are in their 80s, who are not in nursing homes, are going to rate and if they're going to fall through the cracks somehow. Can you explain that?
Yeah, absolutely, because this is a really important group. Just to be clear, the very first group are the hospital workers that we've heard about at Sky Ridge, and also, I think this will start, I hope, as soon as next week, folks that are actually in long-term care facilities. They're number 1A. Number 1B are what are called moderate risk healthcare workers and other first responders, such as EMS and firefighters and public health personnel. We get into something called phase 2, and that's where folks that are 65 and older or people of any age who've got various underlying conditions would be included. We don't know quite when we'll get to that phase. I'm hoping it could be as early as February. The state's currently projecting it could be, quote, in the springtime sometime, and it really depends on how quickly the two vaccine manufacturers can pump out the vaccine or whether other vaccines get approved and can contribute to that.
Great. Thank you so much, Dr. Douglas. Okay, we now have an online question from Dean, and this will be for you, Jennifer Ludwig. What does 25% or 50 people mean? Whichever is greater. I'm not understanding. Thank you.
Certainly. So 25% of posted capacity of your fire code capacity. So if your occupancy is 100, then 25% would be 25 people. But it's whichever is lower. So if your 25% is lower, if, using that example of 100 people is your fire code occupancy, you can have 25 at 25%. So that's lower than 50. So that is the number that you would have to go with. So for really large spaces, 25% is not a whole lot, but the max for those that have those capacity limits, the max is 50. And every level in the dial and every industry has different requirements, so it is very understandable that it gets very confusing. But on Tri-County Health Department's website, we have a lot of tools and cheat sheets and fact sheets that hopefully would be able to explain and help businesses understand where they are in the current dial.
Wonderful. Thank you, Jennifer. And we have another question for you online. Janine would like to know, if we apply for the 5-star program, while we're waiting for approval, can we open at 25%?
Well, thank you so much for asking that. It's a really important question, and we really have to stress that no. Unfortunately, while you are waiting, you cannot operate at 25% until you have gone through and been officially certified. So we are really trying to get a jump start and allow restaurants to start the process and apply beginning as soon as tomorrow afternoon. And the individuals who, with the municipalities, will be following up and going through the checklist, make sure that you have everything ready. Then as soon as we get approval from the state health department, then we will schedule as quickly as possible to get out on site, do the inspection, and provide the certification. But just because you've applied is not an approval for you to open up at 25%. So I know everyone is super anxious and wants to get open, but we're getting there, and we hope to be able to get to all of the interested businesses as soon as possible. But until we have approval and until you are certified, you have to maintain the requirements and capacity of level red.
Wonderful. Thank you, Jennifer. Our next question is for Dr. Lung. Charlene online wants to know, how is treatment for COVID changing? What have you learned that is helping you treat your patients?
Hi, thank you. So this is Eric Lung. Charlene, thanks for the question. Well, there are some differences between the surge that we experienced in the fall versus what we saw in the spring. Obviously, there's still a lot of unknown about this virus, but there are a few things that we have learned. And this has helped us actually be able to discharge some patients sooner. We've been able to lower our length of stay. So the treatments that we have for people with COVID-19 that are admitted to the hospital, there's an antiviral medication that we start patients on called remdesivir, and it's a 5-day medication, and it's only given in the hospital. It's only approved for in-hospital use. In addition, with a little bit less data about it, we have been giving patients convalescent plasma. The data isn't as strong, but what we do know is that there don't seem to be significant side effects. The last medication is a steroid, and that is generally reserved for folks that their lungs are showing a significant amount of inflammation, and we can see that on a chest x-ray. And for the most part, if somebody has COVID-19 and they are sick enough that they're going to need to be admitted to the hospital, then generally their lungs on an x-ray are showing findings of inflammation. So steroids are given and are shown to be helpful. So those are the three therapies that we have learned since the spring that we have been using. And this has been a little bit progressive. That not all three of these things were used, in March and April. The convalescent plasma was sort of developed, as the spring and summer went on. So I think, overall that these therapies have helped us treat patients and get them discharged a little bit quicker. One big difference between now and earlier is there were a lot more patients in this surge. A lot more people were infected. So despite the shorter length of stay, their volume was a lot higher. As you heard Kirk McCarty talking in the beginning, that we were as high as 60 patients at any one time. And fortunately, even as of today, we're down to the mid to lower 30s.
Wonderful, thank you. Let's go to our next live caller. We have Melissa, and her question is for Dr. Douglas. Melissa, you are live. You can go ahead and ask your question.
Hi, yes. My question has to do with the accuracy of the PCR tests. I've spoken with someone who's familiar with them more in a law enforcement context, and I've seen a lot of instances where there's big problems, even in the COVID context, with their accuracy, that they can pick up any coronavirus that a person might have, or, a piece of kind of DNA that's not COVID. And I saw Florida put in place a cycle threshold limitation. Excuse me. Wondering if there's, of anything like that on the way in Colorado.
Yeah, thanks for the question. I'll take it, but now that I realize I've got a good colleague on the phone, Eric may want to comment if I'm not getting at it entirely. The issue of PCR that you're referring to has got to do with how both sensitive the test is and how specific it is. Sensitivity is if you have it, is the test going to register positive? Specificity is if you don't have it, is it going to give you a negative? There have been concerns. There were originally, way back in the beginning, concerns maybe we might pick up non-COVID-19 coronaviruses, because there are other coronaviruses that circulate in the community. That seemed to be settled pretty early, that because they cause 20% of common colds. That didn't really appear to manifest itself. In other words, we weren't getting that kind of reaction. There is a concern, however, because this test will pick up not living virus, but just the presence of the viral genome. And if one has a small amount of dead virus, which is kind of the example you gave, one could register a positive test. People have talked about using lower cycle numbers, and I don't know that any of the hospitals in Colorado, and I haven't seen any recommendations from CDC or the national laboratory groups about doing that sort of cut point, but it is a topic of conversation. At this point, I think the interpretation of the test still considers PCR the gold standard, but this is we still call it the novel coronavirus because it's new and we're continuing to learn new stuff. And it may be that PCR cut point gets modified as well. Eric, I don't know if I have the latitude to ask Eric to comment, but he might have a thought.
Hi, Dr. Douglas. I think you answered that very well. I don't have anything else to add unless the caller has another specific question that I'd be happy to answer.
Thanks.
All right. I think the caller is off the line now. So let's go ahead and go to our next online question. We have a follow-up question with Janine, and she would like to know, how long do you think the certification process will take? And that's for Jennifer.
That is a good question. And because this is brand new, we are not sure exactly how long. I think it will depend on the level of interest and how many applications we have. We are trying to build up as many staff members as possible on the team to be able to go out and do the on-site inspection, which we imagine will take the longest part of the process. I would hate to say that it will take a week or longer. I know businesses are going to be very antsy as soon as they submit their application, but because we're not exactly sure how long it will take, how many applications we'll be receiving, to really determine what our turnaround time will be. I believe, wanted to try to be out and follow up within 3 to 5 days. We will have to adjust that as we determine the level, the sheer number of applications that we have. And then with the holidays coming up, we're working as quickly as we can to get this process going. I don't have a great answer because we're really not sure exactly how long it will take from start to finish, but do know that we know the need for this and are ready to go, and we will be working as diligently as possible to get to every applicant.
Wonderful. Thank you, Jennifer. All right, we have another question online from Stevie, and this is for the commissioners. Can the commissioners share how CARES Act funding has been used to support businesses and others in the county? Let's go ahead and hear from Commissioner Thomas first, and then after Commissioner Thomas, let's hear from Commissioner Layden. Go ahead, Commissioner Thomas.
Thank you, Erica. So the county received $30.1 million in CARE funding. We were not one of the 5 most populous counties in the state. Those counties received their money directly from the federal government. And for example, Adams County got $90 million. We had to share with the other 58 smaller counties to try and get money from the governor. And we finally ended up with an allocation of $30.1 million. That is being held at the Department of Local Affairs. So what we need to do, we have partnered with all the municipalities so that we can help distribute the money more quickly. We are providing that to businesses who needed to retool their businesses to get open after May 22nd, also with nonprofits. And just recently, we are making grants available to reimburse businesses for what they can show through previous revenue streams, how much they have lost. And at this point, we are able to provide funding for 100% of what restaurants are missing out on for the month of December. That needs to be calculated through December 20th and then very quickly submitted through the county's website, which is douglas.co.us. We've had many small businesses who have received $25,000. We had another restaurant who received $172,000. So far, we have given over $2 million to businesses. So if you are a small business owner out there, please go to our website right away and make your application. If you're having trouble, thank you for putting that screen up. Give our staff a call. They are very willing to help you because we have $15 million that we've set aside for businesses, and we want to get that distributed to all of you so it makes a difference. After all, that's the purpose of that money. Thank you, Erica.
Wonderful. Now let's hear from Commissioner Layden.
Great. Thank you, Erica, and thank you, Commissioner Thomas, for that explanation. I'll just add that the county is in this with you, and Commissioner Thomas states that well, that our staff is very capable and is really linking arms with individuals and businesses to ensure that we get through this difficult time. Specifically, the CARES Act funds that have also been used to provide support to individuals in need through the general assistance grants totals nearly $550,000 as of December 10th. And I really want to send out a special thanks and note of appreciation to our nonprofit community for really all of the support that they have provided over the last 9 months. In terms of county donations, we've provided about $52,000 to our local food banks. And then as of December 14th, over $1.1 million has been awarded through the Douglas County Nonprofit Grant Program, and the final round of applications are due tomorrow.
Wonderful. Thank you, Commissioner. Let's go back to our online questions here. We have Timothy, and his question is for Jennifer Ludwig. He says, speaking of improved ventilation in restaurants, what needs to be modified to HVAC units in order to be compliant?
Thank you for that question. If you have looked at the checklist, it sounds like you've done some homework and you've already looked at what would be required. There are some HVAC requirements for improved air quality and ventilation. And this, it may or may not be a simple fix for some restaurants or for businesses. But the main thing is to make sure that it is equipped with the highest rated filter and that you have a plan and a process for changing those filters. And it's set to run continuously when people are present. And it's operated at the highest optimized setting for the space, and that it's serviced by an HVAC technician at least twice per year. There are some other things that we could work with each business depending on what they know about their HVAC system and what they already have established. But if you're not changing filters regularly, that would be an improvement. If you don't have the highest rated filters, we would ask that you invest in those. And if you're not having it serviced twice a year, that would be a requirement to meet for certification in this program. And just a really quick plug, there are a lot of tons of questions, I imagine, from businesses wondering, what do we need to do? What, in addition, do we have to do? I would recommend going to the Certify My Business webpage, Douglas County's webpage, where links to the checklist and the requirements will be available. And then in addition, Tri-County Health Department has a business recovery task force or reopening task force, and they do weekly webinars, usually on Fridays. That may change because of the holidays. And many of these questions will be addressed on those webinars. We want to make sure that we're providing all the information that businesses need to be ready to apply and be ready for their on-site inspection so that they can be certified. So I would recommend checking out Douglas County's webpage for more information, as well as Tri-County Health Department's Business Reopening Task Force webpage, where we have information on how to get a hold of that team, as well as their webinar information. So thank you.
All right, let's move to a live caller. We have RJ for Dr. Douglas. RJ, you are live. Go ahead and ask your question.
Thanks for taking my question. Yes, Doctor, I was curious, is there any way to move educators up the list to get vaccinations earlier than some others so that we can get our kids back in-person learning? These kids are struggling, especially at the high school level, as I have some. And I was just curious on what your thoughts are, if that's a possibility.
Well, my thoughts are that that's a really interesting and important idea, and I honestly am very sympathetic with it. The process of educators or essential workers, educators are included in Phase 2. Phase 2 has a lot of other groups in it, including other essential workers as well as other high-risk individuals. We're currently trying to figure out with the State Health Department who will be making allocation rankings within that group. The governor's already been asked about this several times, and at least thus far has deferred from saying, yeah, I agree with you, let's put educators at the top of the list. I think this conversation is going to continue. I think there's a recognition that there are people who, if they are protected from infection, will have what many might consider a multiplier effect. Certainly keeping our hospital staff protected has a multiplier effect in terms of hospital capacity. I think you could make the same argument for teachers. So stay tuned. I think a lot of people are asking the question that you are.
Wonderful. Thank you, Dr. Douglas. And thank you very much to Mr. McCarty, Dr. Lung, Ms. Ludwig, Dr. Douglas, Board of County Commissioners, and everyone who has joined us tonight. You have asked so many thoughtful questions, and we really appreciate you taking the time out of your evening to be with us. We have time for a few more questions before we wrap up. And now let's go to, we have Pat. Pat is online, and his question is for Mr. McCarty. He says, I have been putting off the surgery because it isn't an emergency, but I do think I'm ready now. Is now really okay for me to go ahead and have it? Mr. McCarty, you can go ahead. Go for it.
Yep, this is Kirk McCarty. Thank you for the question. I can tell you that now is, if you have a surgery that's not elective, but is a priority, now is a safe time to have it. We have, all the hospitals have processes in place to make sure that patients are tested if we're worried about COVID, as well as keeping patients separate and safe from the other COVID patients. In fact, at Skyridge Medical Center, we have a separate unit where we put patients with COVID just to make sure that remains isolated. So I would encourage you to get with your physician and get scheduled as soon as your physician and you think is the right time for you to have surgery.
Wonderful. Thank you, Mr. McCarty. And just a final reminder, we had a lot of questions this evening. Thank you so much. And if your question wasn't answered tonight, we encourage you to please visit douglas.co.us/citizenconnect. You can submit your question and we will respond. Now, before we conclude our live town hall, we'd like to give your Douglas County Commissioners a few moments for their final comments. Commissioner Layden, let's hear from you first.
Well, again, just a tremendous thank you to everyone for participating on this call and the hard work that has gone into the last 9 months. We know this has been a very difficult time for everyone, but I just wanted to, on a note of optimism, invite everyone to join Douglas County, your Board of County Commissioners, and all 378,000 people that we represent in a special fireworks celebration where we can really say goodbye to 2020, celebrate the optimism that the holidays usher in, and hopefully look forward to a great new year. So again, that's this Saturday at 7 p.m., High in the Sky fireworks to celebrate the coming of a new year. Thank you, Erica.
Wonderful. Now let's go to Commissioner Laura Thomas.
Thank you, Erica. I'd like to highlight something that we heard from Dr. Eric Lung from Skyridge. He was talking about treating patients with COVID, and he talked about convalescent plasma. So I think it's important that if you have tested positive for COVID and have recovered, that you donate some plasma at a Vitalant center. Let me just tell you that I did test positive for COVID in November. I was home, I was sick. I was very tired. I had a cough, but I've recovered. I have tested negative, and I have gone to Vitalant and done a plasma donation. So this is a great opportunity for us to help others who are struggling, as Dr. Lung discussed. So please consider going to the Vitalant website and finding out where there is a donation site close to you so you can help others. Thank you, and we'd like to wish all of you a Merry Christmas, Happy Holidays, whatever tradition it is that you follow. Thank you.
Thank you, Commissioner Thomas. And now let's hear from Commissioner Roger Partridge.
Thank you, Erica. And first, I really want to thank Mr. McCarty, Dr. Lung, Dr. Douglas, and Jennifer for joining us again to give some wonderful responses and great information to our public. And also to those on the call, those who unfortunately may have had COVID, we feel for you, and especially if there has been any loss in you, your friends, and families. We have very heavy hearts for you there. And also, I would like to.
Commissioner Thomas, and now let's hear from Commissioner.
Are you there, Eric? Can you hear me okay?
Yes,
Yes,
We
I
can
can.
hear
I
you,
think
Roger.
somebody was playing
Okay.
the video online in the background.
Okay,
Go ahead.
sorry about that. So hopefully you've heard my previous message, but I want to tell everyone this will be no doubt our last telephone town hall of the year, but the last one of my career as a commissioner in Douglas County. And I want to thank everyone. It's been such an honor and a privilege to serve you. And even though this year has brought many challenges, in the other years, I feel we've accomplished numerous things that have brought so much to Douglas County to make it a better place to work, live, and play, because it's a wonderful county and it's you, the people, that make Douglas County great. So I just want to tell you, thank you so much. And I was just reminded from Commissioner Layden that the fireworks show is not actually a celebration of me leaving. It is actually the celebration of 2020 leaving, and that we're looking forward to 2021 with all of you. So thank you very much. God bless you all.
Thank you so much, Commissioner Partridge. And on behalf of Douglas County and the Tri-County Health Department, thank you for sharing your time with us, and we hope you will join us again for future town halls. Be well, be blessed, and good night.